Yeah, absolutely. And I think, we're adding to a TKI and IO backbone here. The question always is, if we're building doublets and triplets of first line, it opens up the Pandora's box of what do we do in second line. So even this dumb urologist knows that cabozantinib is a very important drug in our sort of backbone of treatment approaches, but we're always trying to do better. So you want to walk us through LenCabo?
Yeah. I mean, this was great work presented by Aly-Khan and, led by Nizar Tanir in the group at MD Anderson. So really great work to ask a very pragmatic question. What is it like when we look at these combinations up front? What do we give next? And so Len-Ev, which is FDA approved, Health Canada approved in many countries, but not reimbursed in all of them. Certainly in Canada, it is tougher to get depending on insurance. But nevertheless, there was a registration phase 2 trial of Len-Ev. And so this trial was essentially saying in a phase 2 setting, can we see how Len-Ev, Len at 18, everolimus at 5 daily goes against cabozantinib, randomized 1-to-1, 90-person trial for patients who have clear cell RCC and progressed after immunotherapy, stratified by MDC risk group and prior receipt of VEGF targeted therapy. Again, an interesting study, just I think to look at PFS and can we get a hint of what's going on. This was a multi-center investigator-initiated trial, so again, kudos to the team to pull that off. I mean, what you see is that in all patients that they reported on, 86 patients, 40 in Len-Ev, 46 in Cabo, largely well-balanced, although it is important to point out that most treatments had one prior line of treatment. Okay, so 70%-ish about these patients had only one prior line, of whom only about 43% had a prior VEGF targeted therapy. So you could imagine a lot of Nivo-Ipi progression here as a first-line option, and maybe they had Sutent after and then this trial or directly this trial. So, we'll get into that in the paper, but I think the real takeaway at this point is in the first kind of signal readout, cabozantinib had a median PFS of about 10 months. Len-Ev looked like, 15.7 months. Hazard ratio was really impressive at 0.5 for the totality of the curve. What was interesting is that response also looked better. In the Len-Ev arm, 53%. Primary progressive disease was low in both of these studies, less than 10%. But the odds ratio was about 1.87, so not significantly different. OS was kind of immature at 20 months of median follow-up. Patients in both arms seemed to really overlap with a hazard ratio of 1.05, north of around 85% one-year OS probability. But again, with how active these drugs can be, especially if you've not had a prior VEGF TKI, I think there certainly needs to be longer follow-up. So, again, my takeaway is this is a tease for what we'd want to see in a future trial.